All right. So, Dr. Cantu, thank you very much for making time to talk with me today, and all the time that you've made over the past couple of years, and especially during this pandemic, to advise me on basically how the city is responding and to keep me informed of things that are happening in the health community. You're famous now. You are the first person to get the vaccine, the COVID-19 vaccine in San Antonio, and you're making all of the District 7 residents extremely proud because that's where you're from, where you live. I thought maybe we could start by having you tell us a little bit about yourself and what led you to be the person to get one of the first vaccines.
Certainly. Well, first of all, Councilwoman Sandoval, thank you so much for inviting me to have this discussion. I'm really looking forward to just kind of talking about the whole experience. So to begin with, my name is Adelita Cantu. I am a San Antonio resident, District 7. I was born in San Antonio. I was born on the south side and I'm the west side, I'm sorry, and then moved into the area pretty much where I'm at right now. I have been a nurse for a long period of time, over 40 years, and my expertise or specialty is public health nursing. I moved back to San Antonio after living in Dallas and Waco in 1988, yes. I've moved back here and have been working in the community since then. First through University Health System and the old Brady Green, worked at the old Brady Green, one of my favorite jobs that I had. And then I moved over to the Health Science Center School of Nursing in 2002. First of all, to pursue my PhD in nursing. And then after I did receive it, I just continued staying there. So I am teaching. I'm teaching mainly undergraduate students in their public health experience and taking them into the communities. I particularly focus on the West Side and vulnerable populations and facilitate their learning about social determinants of health. So I've really been blessed to be able to do that. How I came to be the first person was a very roundabout, very spontaneous story. So Monday of this week, I was asked by our marketing team to be within the first group that was going to be receiving it. So I said, sure, that'll be fine. Just the first group of, 15 or 20, whatever the case may be. And so it kind of changed a bit from then. So on Monday night, it was, okay, we got the vaccine sooner than we thought. So we're going to do it on Tuesday, Wednesday. I said, okay, I'll be there Tuesday. And they said, come in at 1 o'clock. And so I said, fine, I'll be there. And so Tuesday I was working from home, doing my work from home. And I don't live, maybe less than 15 minutes away from the Health Science Center. So about it was about 11:30 or so, I got a call from our marketing person. And first she asked me, she said, are you sitting down? And I said, yeah, but it sounds kind of ominous here. And so she said that she asked me if you would be okay with actually being the first person to get it. And so I said, probably because I didn't have any time to think about it, other than just saying yes, I was going to get it anyway. So that was the way I kind of fell into it, of being the first person to be privileged enough to get the vaccine. And when I came into the Health Science Center, then it was a student who was entering her last semester of nursing school this coming spring, who then administered the vaccine. And so I was privileged and had the opportunity, and I understand even more so how critical it is to be that first person in terms of letting people know the experience. So I appreciate the opportunity to do this to your audience.
Well, why don't we jump into that? Tell us about the experience. Sure. You've probably gotten lots of vaccines in your life because you're a public health nurse and you take care of yourself. But yeah, tell us about the experience.
Sure. Yeah, I came in there, and of course, I knew when this pandemic started and the push for the vaccine, I knew that it was going to happen just because I have such faith in medical science. I know that it will happen. I, along with everyone else, was so pleased that it happened as quickly as it did with such efficacy as it has. That was one thing. So I knew that it was going to be happening again. So again, being one of the first that was going to get it, I went into the Health Science Center. The nursing school is excellent right now in terms of how they've organized everything. So came right on in, went through the motions of registering to show the media how a person comes in and registers. Then they go into what we call the Heard Auditorium, or one of the big classrooms that we have at the School of Nursing. And interesting that it's called Heard Auditorium, H-U-R-D, in which we're trying to get herd, H-E-R-D, immunity. So I thought that was, so anyway, went into there, then was introduced to the student who was had been chosen to give it. Then I sat down. I'm right-handed, so I knew I'd probably be sore, so I asked him to do it on my left arm. Then as they wanted, the media, I almost feel like what either Princess Diana or one of the movie stars felt like, with the paparazzi all around. So they were all around in a complete circle, and all faculty and staff, everybody was taking pictures. And then Kendra went through the questions with me of, are you allergic to anything, etc. Typical for the flu shot. And then she went ahead and administered it. And actually, she did excellent. I did not feel a thing. It did not hurt. There was no prick or anything, other than when she said, there'll be a prick. But again, I didn't feel anything. And the needle is small. I mean, it's not a long needle or anything. So I want to emphasize that to people, that it's a very thin syringe with not that long a needle. And so then I went into another room to wait 15 minutes for observation. So the process is you get it, then you go into another room to see if there's going to be any reaction to it. I waited my 15 minutes. I did not have any kind of reaction at all. And then I went and talked with the media, did some interviews, etc. Later that day, I would say towards the evening, is when my arm started getting sore. But again, very typical for your flu, right in your upper arm. I still had movement in it, range of motion, everything else. That was Tuesday. So Wednesday, probably, Wednesday it continued to be sore. Then Thursday afternoon, it had pretty much dissipated by then. All that time had range of motion, no problem at all with the arm.
Wonderful. So when is your next dose, right? This is a 2-dose vaccine.
This is a 2-dose vaccine. This one, the Pfizer, is 21 days apart. The new one coming out, Moderna, is 28 days. 21 days for me will be January the 5th on a Tuesday, and coming back to the nursing school to receive that second dose, which is considered really the booster.
And so a booster. So do you think you have immunity now, or do you think you really don't have it until?
So the way I've understood the science behind this is that the first dose within 2.5 weeks provides that immunity to protect yourself. The booster dose, from what I understand, then goes towards the full year, 9 months to 12 months of protection. Now, do you need it next year again? That I don't know. I have not heard that you do, but again, you will have a full immunity after the booster. Just think about the measles too. It's similar to the measles vaccine. You have certain scheduled doses, and then you have to come back within a certain space of time for your booster. So you boost your immune system.
Okay. So what gave you the confidence to be the first person? And what would you say to people who do have concerns about the safety?
Sure. So definitely I had confidence in that the vaccine is effective because of my knowledge about medical science and the evidence that goes towards releasing something like from the FDA, CDC. I mean, the evidence has to be there. Whether it's needs to be a 90% effective, 95% effective, it's there. Pfizer is an excellent company. I knew that they would not release data that they do not have. So I had full confidence in that. Now, if some of the, I don't know if it's notoriety or whatever from being the first person that has received it. Like I said, it was like, originally it did not hit me what the full impact of that meant until I started with the interviews for media, or they started talking to me. And I realized that that's a platform, and a platform to get the message out. So you say, yeah, and there are people, in fact, I went to the eye doctor yesterday, and we had a conversation about the vaccine, and she was talking about how they're still trying to get their staff to be confident enough to take it, some of the staff. So yeah, I am seeing that this is giving me that platform to help people understand and hopefully trust the vaccine. Uh, in terms of experiencing anything, I have not experienced anything at all. People that I've heard that have taken it have not experienced anything at all other than that sore arm. So first of all. Second of all, I want to message that we want to not only protect ourselves, but we want to protect our family and our community. And the way we do that is by getting as many people vaccinated so that people that can't get vaccinated, such as the immunocompromised, will not have it easily transmitted to them. So the more people that we get vaccinated will stem the transmission of it, so that people who can't get the vaccine are more likely to be protected. So it's that level of what they're calling herd immunity that we need to get to, because that helps us protect everyone in our community. And as a public health nurse, that's my whole goal, is the wellness for all the community. This is one way to get there.
So what do you say to people who think, well, the vaccine is on its way, we can start to relax now, everything will be fine?
Yes, yeah. Well, that would be nice if we could say that. Unfortunately, at this point, because we haven't gotten to that level of herd immunity or getting as many people as possible vaccinated, there is still the transmission is still an issue. So because it can be transmitted, we still need to be very vigilant about wearing our masks, washing our hands, social distancing. That's important right now. And even for me that have been vaccinated, I do not know, and there's no evidence right now that says, well, I am protecting myself, but there's no evidence that says if I come in contact with the virus, I might still be able to transmit it to somebody else. So again, I need to be cautious of that, because I want to be protecting my family, my community, my neighbors, etc. So yeah, the vaccine is going to protect me, but I'm not sure if when I come in contact with it, I may still be able to transmit.
Mm-hmm. Yeah, so I heard that the benefit of the vaccine is in case you do come into contact with it, that you don't end up really ill or in the hospital.
Right. And yes. And just like the flu, I think a lot of people, when they experience getting the flu vaccine, many times it does mitigate some of those symptoms that we might have either when we get the flu or on any other type of respiratory illness. The COVID will do the same thing. If you do come into contact with it, you may be one of those people that just don't have any symptoms, but still may be able to transmit it. Again, that's why it's important to be vigilant.
And do you have any tips for people who are celebrating the holidays this year? How can we do that safely?
I would have to go with what Dr. Bridger was saying yesterday. If at all you can do without traveling this Christmas season, do that. Don't travel. Don't go across even our own community to be with your friends or family. If you do choose to do that, there are certain things to keep in mind. Being outside is better than being inside, for one. Being outside. If you're going to be in the same household with someone you don't regularly live with, wear your mask, even inside. Social distance, rather than maybe having one table, try to set up two tables to eat where people can distance themselves apart. Just like it happens when you go into a doctor's office, they arrange the chairs now. So there is space between there. If you're eating home style where things are left on the table, you then serve yourself. Everybody get your own utensils and get the food with your own utensils. And then hand washing, hand sanitizers everywhere, the wipes everywhere. So even if you do choose to be with your family and friends, there are some precautions you can take to reduce the transmission of it. But the overall message would be to limit those type of interactions. And remember, holidays is a 2-week period of time. So maybe you're vigilant on Christmas Day, but maybe not on New Year's Eve, or you're thinking, well, New Year's Eve is, so it's that whole 2-week period of time that we really, really have to be very vigilant.
Okay, so my last question, in case people are wondering, when will members of the general public be able to get the vaccine?
Now, I have not heard anything specific to the San Antonio area or the Bexar County area, other than what I'm hearing from national leaders is hopefully by the end of March, that March to April, that you would be able to walk into a CVS or a Walgreens and ask for the COVID vaccine. So I'm keeping my fingers crossed that that does happen. And that will then help us go into spring and certainly into fall and next holiday season, where we can gather with our friends and family safely. So everybody keep your fingers crossed for that period of time. It does sound like they're producing enough vaccine. So it's getting that those first priority groups done and then opening up to the general population. And my understanding is that our health systems here in San Antonio are moving really, really quickly to get their staff vaccinated.
Okay. So last question. Tell us something about you nobody knows.
Okay. That nobody knows, even you?
Maybe I know. Maybe.
Okay. Well, I have, yes, and you would know this. I sometimes use this with my students when I ask that same question. One thing that nobody knows about you is that during the time when MS Bike to the Beach was being done as a fundraiser for the MS Society, my husband and I did that 5 times. And I know
oh my God.
Councilwoman Sandoval joined us one of those times. I can't remember exactly what year it was. What year? I can't remember now.
Oh, it might have been 03 or 04, something like
that. But I did it 5 times.
Wow.
I did it like 9 times. It was 150 miles from here to Corpus using 181 down going. And now, of course, because of traffic and the building, how they built up 181, you can't do it any longer. It's too dangerous. But it was fun. It's a lot of training. And again, Councilwoman Sandoval joined us on one of those years with all the training runs that we did as well.
I don't think you rode that year, but you did all the training with us.
Yeah, that may have been the case.
Yeah. So, well, thank you so much, Dr. Cantu, not just for today, but for everything you do for our community. And so excited to see you getting that vaccine. And maybe we'll talk again on the 5th.
Thank you so much.
All right.
I appreciate it.